Hi, I'm Laura, registered massage therapist from the Village Health Clinic, and today we're going to talk about balance. So what is balance? Balance is a state of equilibrium in our body that allows us to move or remain stable without falling over. So let's identify the components of balance. First, we have our center of gravity, and that hangs out at about here. The lower our center of gravity is to the ground, the more stable we'll be. We're much more stable when we're lying on the ground than we are standing upright. We also have a line of gravity that travels through our center of gravity that needs to stay within our base of support. That helps us stay stable. Our base of support can be our legs, just like this. The wider our base of support, the more stable we are. When my base of support is wider, my line of gravity has more room to move to allow me to stay stable. So I'm going to offer 3 great balance techniques that you can implement into your everyday life and your home care and exercise routine. It's just important to remember when you're starting or wanting to introduce a new exercise and you already have some pre-existing balance or vestibular issues, just consult your primary healthcare provider before you start anything new. So these balance strategies can help us in our everyday life when we experience external forces like wind, when we're on a subway, when we're on a bus, even when we're walking on an unstable surface. So these strategies will help us remain stable against all these external perturbations. So the first strategy we're going to talk about is the ankle strategy, and that's down here. We're going to use our muscles here called our gastrocs and our dorsiflexors here. The main one is our tibialis anterior. And all we're going to do is we're going to make sure we're stabilized on the ground, and we can even use our arm to stabilize us on a wall surface. Let's keep our eyes open for now. This is level 1. All we're going to do is gently go up on our toes and then rock back onto our heels, and up onto our toes and back onto our heels. Now if that becomes too easy, what we can do is stay stable on the wall, but now we can close our eyes. So we're taking away some sensory information here. And again, if that becomes too easy, we can reopen our eyes, but take our hand off the wall. If this becomes too easy, we can even try this on one foot now. Now I would suggest putting one hand back on the wall, lifting up one leg, and coming forward and back on our heel. It's important to remember we want to start slow and then progress to more challenging exercises, but that's the ankle strategy for you. So the next strategy I want to talk about is called the step strategy. And the step strategy really simulates walking in everyday life. So if we have forces like I mentioned before, wind, or when we're on an unstable surface, or even if we get a little knock from behind, we can use this strategy to help train us. So simply we take one foot and all we really do is step forward and back. And we can even step to the side. We're using some different muscles on our side here. Step to the side and back. We can even step back and forward, and then do it on the other side. Forward and back, to the side and together, and backward and together. If it's too challenging to do this without holding on to something, we can regress back to level 1, and we can hold on to the wall here and step together and step together. Try incorporating these new balance strategies into your daily self-care routine. You can even start with 2 to 3 days a week and see how you feel. And let us know in the comment box below. Thanks for watching.